Today we've got a discussion on IFAKs, individual first aid kits. Now, working in the ER, I see all sorts of injuries that come in from simple scrapes that need nothing except a Band-Aid, but we appreciate you stopping by, all the way up to much more severe hand versus chainsaw, hand versus table saw, arm versus window, hedge trimmer, knives, gunshots, that sort of thing. And if you can get some of the care started out in the field before you get there, that'd be ideal. Probably the biggest thing you want to get started is hemorrhage control, bleeding control, that sort of thing. All bleeding, as we say, stops eventually. It's really only bad when you can hear it, as I tell patients. But we do try and catch it before you run out if we can. Ideally, if you can kind of stop it off in the field, all the better. And so it's good to have some kits that you can kind of get things started with, some different supplies, and you can kind of get the care started. So by the time you get to the hospital, if the bleeding has stopped, we very much appreciate that. Saves us some effort. Little medical tip for you, just as a FYI here. Bleeding, usually elevation and pressure will stop almost all bleeding. You can even throw a little bit of ice on it. That'll help constrict the blood vessels. I've had people come in, cut their finger, and you get the radial digital artery here, and it will actually squirt. I've seen it. So put some pressure on it, 20 minutes, elevate it, and that should actually, cough that off, stop the bleeding. And that works with most places on your body. Sometimes you'll get the artery just right, and you have to come in, we have to kind of tie it off, and it's a little bit more involved. But for the most part, your bleeding will clot off with pressure and elevation. And again, a little bit of ice, if you have that, you can throw that on there. And that will do wonders for it. Cut down some of that blood loss. So anyway, moving on. I've got two bags that I have. I have a bug out bag that I keep in my house, and then I've got a bag that I keep in my trunk of my car with some different supplies in it. It's a change of clothes, some extra food, an extra magazine, extra flashlight and knife, that sort of thing. And I wanted an IFAK for both of those. So I decided I'd get two different brands because there's a bunch of different styles and brands and sizes, and decided I'd get two different brands so I could kind of compare and contrast them for both myself and for you, and maybe give you some different decisions on what you might be able to buy for yourself. You can buy these empty, as I did. You can also buy them pre-stocked. Some of the complaints I've seen about some of the pre-stocked ones is that the quality of material that come with them can be a little bit subpar. The Voodoo one you can actually buy pre-stocked with actually pretty good stuff and a lot of similar stuff to what I've put in them ultimately. But I decided I just want to kind of customize my own. There's still some stuff I'm thinking about adding a little bit later, we'll see. But I've kind of gotten started with this stuff. I have these loaded both roughly with identical stuff, and I'll give you an idea of what that is. I'll show it to you as I kind of go over some of the features of these bags. So, moving on to these two bags, I have a Maxpedition one and a Voodoo Tactical one. The bags these are going on, I have a Maxpedition Vulture 2 of this same color, and the Voodoo Tactical I'm going to put on my LA Police Gear 3-day pack that I previously reviewed. The Maxpedition one, they're both about the same price. They both run around $20. They come in different colors. The Maxpedition one comes in black, OD, foliage green, and khaki, whereas the Voodoo Tactical comes in more colors: black, khaki, foliage, ACU, OD, and rescue red. Material, they're both a denier nylon. The Maxpedition one, if you've seen some of the Maxpedition bags, they are that super tough, very stiff denier nylon. I don't know, maybe like 1,000 denier or something. This is a much more pliable 400 denier, 420 rather. So nice and soft and pliable. I think it's just perfect for that. The Voodoo Tactical one is that much stiffer, thicker, kind of similar to what most of the bags are made of. Nylon, a little bit tougher. Size-wise, they're pretty similar. The Maxpedition one is actually an inch bigger. The Maxpedition one is allegedly 8x5 by 2.5, and the Voodoo is 7x5 by 2.5, although in the end they look pretty similar. The Voodoo one you can buy stocked for $60. So again, if you're not sure what you want in it, it comes with a pretty decent amount of stuff. I think the biggest thing I've seen, a lot of these ones that come pre-stocked come with one pair of gloves, which I think you need more than that. Obviously, you could certainly add some more gloves. That's easy enough to do. But let's go ahead and go over the design of them. On the front of them, obviously different. The Voodoo bag has just some pals webbing on the front here. The Maxpedition bag has a zippered mesh pocket here for easy access for some simple stuff on the outside. Bottom of the Maxpedition bag has a carry handle. Voodoo bag does not. They both have paracord zipper pulls. There you go. And then on the back, a little bit different ways to attach these. The Voodoo bag is going to attach vertically, And it has these straps here that you can feed through the PALS webbing on your bag and then just snap on. Nice and simple, come pre-included. The Maxpedition one is a little bit harder. It comes with the webbing and you're going to need something to attach it. I bought some of these Maxpedition Tacties. They come in different sizes. These are the 3-inch ones. And basically you feed them through the webbing here and then you put it through here, and this little piece here catches on this. I haven't actually tried putting this on my bag yet. I'm going to do that at the end of the video. I've heard that they're super stable once you get them onto your bag, but don't look at getting them off anytime quickly because they are very challenging to get off. But again, they come in different sizes. This is the 3-inch one to fit with this. Fairly cheap, I think $5 I got them for. So there's the basic outside design of the bag. Moving on to the inside. These have a zippered pouch. Now the Maxpedition one is going to clamshell open all the way, whereas the Voodoo one does not. It has some straps here that are going to keep it from, the straps right on the side there, they're going to keep it from opening all the way. So we'll have to look in the inside of these separately because it's hard to get in there. But let's do the Maxpedition one first. So this has zippered pouches on the inside. It has here, this zippered pouch will come, this is a zippered mesh pouch, which will again fully open up on this side. And then on this side there's another clear mesh pouch, which is just, you can get into that way. In the middle here there's a little connecting flap. I put a little Sharpie there, fine point Sharpie for marking on stuff. And you could fit some stuff in between these, I suppose, but it's very nicely organized. And this side over here is actually, pretty thick. You can actually get some decently deep stuff in there. I'll come back to the contents in just a minute. Now let's look at the Voodoo Tactical one. Move this one out of the way. The Voodoo, basically, it will not clamshell open all the way. It has these elastic straps that will keep it open. The idea with this one, I think, is that you're going to mount it on your bag, you unzip it, and then you'll kind of pull it open this way to get to the stuff on the inside. This one is organized a little bit differently inside. It has these straps that you basically affix everything into. I don't think these are as good to get stuff into. I mean, yeah, you can see this nice, but like in these back bigger straps here, I have a bunch of stuff kind of jammed in there because it's just not as well organized. And then I have this little Israeli bandage just kind of floating up in here, and my finger splint floating up in here. So, I mean, it all fits just the same, but I don't think it's as easy to organize it as it is with the Maxpedition bag. So let's take a look at the supplies I have in these. I'm going to use the Maxpedition one as an example just because it's easier to get into. So on the outside of this little zipper pouch, I have a Ziploc bag, small Ziploc bag with, I don't know, must be 5 pairs of nitrile gloves in here, kind of Ziploc, almost vacuum packed in, so nice and compact there. And one of the things I designed with these pouches, it's kind of it's a matter of what do you want to be prepared for. And I've kind of decided to kind of be prepared for very simple stuff up to slightly more complicated stuff. I'm not going to get into full trauma stuff, but I wanted to have kind of a range of stuff. So a pair of gloves for universal precautions, obviously, and then otherwise on the outside here, just some small band-aids for some simple stuff, some larger band-aids. I am going to add some of the knuckle, sort of those H-shaped band-aids, a couple packets of some bacitracin, some antibiotic ointment, and some Steri-Strips, some large Steri-Strips. There's two pieces of each of these Steri-Strips in here. You can trim these down, and for simple wounds you can use these on, or you can even use these to kind of Steri-Strip it together until you can get to the hospital. Some people refer to these kind of as butterflies. Everyone that comes to the ER wants the butterfly. Can't you just butterfly it? Can't you butterfly it? I don't want stitches. Please butterfly it. No, I can't butterfly everything. Anyway, so Steri-Strips work well for some simple stuff where there's not a lot of tension on the skin. I think that's everything that I've got on the outside here. Moving on to the inside. On this smaller side here, I have a aluminum finger splint. Put this on your finger. You can bend it, you can trim it down, you can put 2 fingers on it and buddy tape them together. Again, just kind of depends on what you're using it for, but fairly compact to stick in there. And then some options for clotting. For small wounds, I have some Surgicel. Now, Surgicel is basically a 2x3 inch piece of mesh, basically, and it has some clotting factors in it. So for smaller wounds that aren't bleeding so much, you can put this into the wound, put some pressure on it, and usually that will stop the bleeding. You can then leave it there, trim off the extra, leave it there. This will actually get absorbed by the body. They'll actually put these inside people for surgery sometimes, and it gets absorbed. No problems there. For slightly bigger wounds, I have some Silox Hemostatic Granules. This comes in 2 different forms. It comes in there's a bunch of different type of quick clot type stuff you can get. I went for the granules. Fits nicely in here. This is the 15-gram pack. There's also a 30. And basically you just tear this off, you pour these on, and then you would want to put some type of pressure bandage on top of that. And then this says to go ahead and bring this to the hospital with you and give to the people in the ER. In 10 years of working in the ER, I've never seen anyone come in with something like this. Most people are admittedly not that prepared. You're lucky if they get some paper towel and, as I had yesterday, paper towel and duct tape around the guy's arm. But hey, it works. It worked. But basically for this, you rip this off, pour it into the wound, put the compressive dressing on it. This will form a little gel. It does get kind of hot, around 105 degrees, I believe, is what it gets up to, which is actually better than the older ones used to get. It will not burn you, but it does get kind of warm. There's some instructions for the people at the hospital here. Basically just remove all the gel, remove all the extra stuff, and then irrigate it very well with some saline. But they say bring this packet into the hospital afterwards with you. So for a little bit bigger bleeding, you can put this in there, put the compressive dressing on it. I have some Tegaderm. This is basically some clear film that you can put over something, and you can use this in a lot of places. If you get some scrapes on your finger, you can wrap this around, and it basically is just like almost like a piece of cellophane. It's very flexible, works great for almost anywhere. Protects it from getting in it. Works great. Got a couple of those. You can trim it down. Sometimes I even put them on my fingers when they get kind of raw with certain things. Some gauze. I have some 2x2s, a couple of those, and some 4x4s. 4x4s started this big to fit them in here. They don't really fit. I kind of folded the top and the bottom up and tucked them in there. Got a couple of those. And I think that's everything I've got on this side. So again, for simpler to more complex wounds, you know, some of them might just be a matter of putting some 4x4s on there and some pressure. Some of them you might need to go a little bit more involved. On this other side, nice thing about this is that it opens all the way, and some different options in here. Some Coban. This is basically tape you can buy most of the stuff anywhere. This tape just sticks to itself, and this is good for you put that, like you put the finger splint on. This is great for wrapping it around. It only sticks to itself, won't stick to your skin. Works great. Some transport tape, just for taping whatever you need to. 3-inch ace wrap. This here is compressed gauze. This is some cool stuff. I wish I bought an extra one of these just to open up and show you for demonstration purposes. But this is like $1.50, pretty cheap. And this comes nice and small. It's vacuum packed. So this is about 2x3 by 3/4 of an inch. And when you open it, you know, it's like I said, it's vacuum packed, and it goes from this to being about this big. As you can see here, it is 4.5 inches by 4.1 yards. So you can wrap this around, you know, your forearm, your leg, whatever you need to. Then maybe the ace wrap on top of that. And then for more extensive stuff, I got one of these Israeli dressings. Again, there's a bunch of versions of these sorts of things. There's the Israeli ones, the H ones, the T ones, I believe. I think there's T, but they all work kind of similarly with a little bit different design. Basically, this works for putting direct pressure right on a wound. You can also use this as a tourniquet. You do probably need to learn. It takes a little bit of know-how on how to use it. So either watch some videos on it or buy an extra one, open it, and just kind of practice with it. So again, that's most of what that's all what I've got in here. Again, to kind of prepare for very simple wounds up to some more heavier bleeding wounds that you can use until you have time to get to a trauma center where you can take care of them more appropriately. The other things I'm considering adding, and the one that I keep in my car, I need to get another pair, but I've got a pair of trauma shears tucked back there. Again, you can see that in the Voodoo one, everything, I've got the Tegaderm, and the gloves and the 4x4s and the 2x2s and the sea-locks, kind of all tucked in these back areas here. The tape and the ace wrap are pretty well held in place down there, and then the Israeli dressing just has to kind of flop around in there a little bit. So it's not, I don't think that one is as well organized as the Maxpedition, just for the lack, I think the pockets in the Maxpedition work a lot better. I mean, it still works fine, it'll, you know, it'll still work, but I think the Maxpedition is just organized a little better, a little bit easier to get into, that sort of thing. Some things I'm contemplating still adding to these. I do still need to get some of those knuckle band-aids, the H ones, to put on them. Also another pair of trauma shears for these, although usually I have my Benchmade Rescue, my 915 Rescue, or Triage, sorry, Benchmade 915 Triage, that has a rescue hook in it that I could use. I use this a lot for cutting clothes off at the hospital. Has the glass breaker here. So probably, you know, if I'm in my car and I carry this every day to work, working in the ER, works great. If I'm going to leave my house for an emergency, I probably would grab this to take with it. So the fact that I don't have a pair of trauma shoes in here yet, not the end of the world. In my car, if I'm not working and don't have my rescue or my triage with me, then I've got the rescue shears or the trauma shears in here. Other things I'm contemplating adding, you know, again, it's kind of a matter of what do you need to be prepared for, and there's only so much stuff that you can fit into these packs. But I was still considering adding a chest seal, a 14 gauge catheter and needle for needling chest for tension pneumothorax. You know, how much the likelihood that you're going to need those, probably pretty small. Although if you're in a situation where you do need them and you can use it, it may save the person's life. You do need to know how to use them. You know, if you're going to needle someone's chest, you need to know where to go. Second rib, second intercostal space, anteriorly with the midclavicular line, basically right up from the nipple, just below the clavicle. But you need to know how to use it. You need to know what to look for tension pneumothorax. So if you're going to have some of that stuff, you need to know how to use it and when to use it, that kind of thing. But for my purposes right now, I just want to be prepared for some simple stuff up to some semi-complicated bleeding. Again, to kind of stave things off until you can get yourself to the hospital, until you can get EMS there to help you out. I'm going to go ahead and put these on the two bags, give you a little bit of an idea of what they look like there, and you can see kind of how they're mounted. Alright, well here I am. I've got both bags on their respective backpacks. The Voodoo Tactical on the left here, on that LA Police Gear 3-day bag, and then the Maxpedition on the, of course, the Maxpedition bag. They both go on relatively simple. The Voodoo goes on easier. Basically, you just feed the straps through the PALS webbing here, and you snap it at the bottom, nice and easy. Could go easy on, easy off. The Maxpedition, I've seen people talk about how they had to get pliers to get it on and off, and yeah, I use my Leatherman, because basically you feed it through the webbing, which is easy enough, but then at the bottom you have to pull these little parts through these, I don't know what you call these, and it's a little bit of a challenge to get them through there. It took all of probably 2 minutes to put it on. It was easy enough to do, but getting it off I think would be a challenge, trying to feed this back through here. Otherwise though, getting into the bags, the Maxpedition here, basically, you know, obviously the front pocket, nice and easy. And then the other pocket, the main compartment, you just unzip it and you can get into it. Both pockets nice and easy. On the Voodoo bag, you know, that's got this zipper on top here, and basically you would just undo these and then you can pull that down and you can get into this stuff. So not bad there either. I'm pretty happy with them both overall. Hard to do this one-handed. There we go. But anyway, there you go. If you're looking for an IFAK, check these out. It's the Voodoo Tactical and Maxpedition.